The Minister of Health and Social Services, Kalumbi Shangula, explains that human scabies is a parasitic infestation caused by an itch mite, a microscopic mite which burrows under the skin, lays eggs and eventually triggers a host immune response, which leads to intense itching and rash. Kalumbi adds that the most affected populations are communities living along the northern borders, school learners in the affected regions, and migrant populations in urban and peri-urban areas where access to water and sanitation facilities is lacking.
Revealed that 3,454 cases of scabies were reported countrywide during the period from January to March 2022, and they are distributed as follows. Kunene 1,418, Ohangwena 708, Otjozondjupa 402, Kavango West 375, Kavango East 204, Omusati 130, Oshana 104, Omaheke 46, Hardap 20, Oshikoto 20, Erongo 17, and Karas 10. Scabies infestation may be complicated by bacterial infection, leading to the development of skin sores that in turn may lead to the development of more serious consequences, such as septicemia, heart disease, or chronic kidney disease. The state health facilities have been reporting cases of scabies in the past, particularly in the northern regions. However, as from October 2021, the number of scabies cases have been reported throughout the country. According to the reports, the current transmission of scabies has moved from households to schools with challenges of water supply and where personal hygiene practices have been found to be less than adequate.
Kalumbi further explains that human scabies is usually transmitted from person to person through close skin contact. Primary symptoms of scabies include intense itching, which often intensifies at night, red rash, pus-filled lesions, and a growth of abnormal skin tissue.
The risk of transmission increases with the level of infestation, with the highest risk due to contacts with individuals with crusted scabies. Transmission due to contact with infested personal items, for example, clothes and bed linen, is unlikely with common scabies, but may be important for individuals with crusted scabies. As there is a symptomatic period of infestation, transmission may occur before the initial infested person even develops symptoms. The incubation period can be up to 8 weeks or longer. One risk factor in the development of scabies are overcrowded living conditions such as large households, school hostels, overcrowded employees living quarters, etc. Poor hygiene practices, lack of sanitation facility, or having a household member with scabies or a sexual partner with scabies. But this is not sexually transmitted disease, I must emphasize, but it's due to contact of the skin, the proximity of the skin. Scabies infestation can be diagnosed usually on the customary appearance and distribution of the rash and the presence of burrows. In other words, it can be diagnosed macroscopically. If possible, the diagnosis of scabies should be confirmed by identifying the mite or mite eggs or the fecal matter which is done through examination under a light microscope for mites, for eggs, or the fecal matter.
The ministry's investigations to establish the magnitude and cause of scabies transmission are ongoing, and public health measures have been activated by the ministry's teams in the affected regions in partnership with line ministries. All detected cases are undergoing treatment in the health facilities. Members of the public are thus urged to maintain good hygiene and sanitation.